And switch gears a little bit, if I may. I obviously shared our viewpoint on the sort of industry, what labeling means, some of the challenges that we see, and how we really tackle this. But the reality of this is actually when you get to speak to someone like Pete, who's gone through the journey the other side. So look, Pete, thank you very much for joining us today. I've got a few questions, if I may. I don't know if you want
Sure.
to say anything as an intro before I start quizzing you, but all over to you if that's
No,
okay.
no, the only thing I would say is that as you start down this path of what I'll call is a enterprise labeling solution, it is not for the faint of heart, and it is something that takes time and commitment. Um, One of the questions that are coming up is what's the biggest thing that you learned? One of the biggest things is it takes more time than you expect as you go through this, right? As you go through this transformation. But anyway, we can go through your questions, Gurdip, and I'll hopefully be able to answer everybody's um, or address their interests.
Fabulous, thanks, Pete. Okay, the first one, very simple one. Surprise, surprise. What labeling challenges did Cardinal Health face prior to the current process? So really, what led you to this journey? What was happening, and what were the challenges you guys were facing that led you to seek something to solve this?
Yeah, I think the biggest thing is that we were pretty much diverse in our approach to labeling. Every facility, every acquisition that we made had their own approach to labeling, and that caused, a lot of problems. Um, the speed with which we developed and implemented labels was too slow, and we had a initiative to increase the amount of products that we were bringing to market, and the labeling, it was the long pole in the tent was labeling. Um, the age of our infrastructure. We had six labeling solutions, I think, six or seven different labeling solutions. Most of them were out of support. And so we had to do something to address the age. Um, and then each label was unique, right? Every label, once you saw one label, you saw one label. There was no chance for reuse. So all those things combined really started us on a path that said we need to do something different. We need to, really start treating this as a enterprise asset rather than a this warehouse or a factory asset. So it's really moving from factory warehouse asset to an enterprise asset. That's what we're looking to do.
Yeah, look, that's a really good point you mentioned there. I mean, talking about labeling as an asset, because you're right, because often people think it's just part of the back office and it should work, but actually it's an asset, isn't it? I think you're totally spot on with what you sort of said there.
Absolutely. It's an asset, it's a product, it's whatever you want. It takes design. And you want to maintain it. And once you do that design, you probably want to be able to reuse it. So we have done a lot of network rationalization to where we're moving products from one factory to another. Well, if they have different labeling systems, then when you move a line from one factory to the other, which is not a simple thing to do anyways, you got to worry about supply chain and all the other stuff that's involved with moving a manufacturing line. But then it comes down to, oops, I got to redesign every single label that's on that product, revalidate them, re-verify them, and get them in, and it's just another length rather than moving the line and using the same label because you have the same technology or access to the same technology because it's an enterprise asset.
Great, thank you, thanks, Pete. Okay, so look, you guys see things need addressing. So what was the solutions you sort of investigated? What did you guys do? How did you do your discovery to go and figure out, what should you do,
You
to
know,
overcome these challenges?
yeah, at the time, we really canvassed and hired a consulting firm, canvassed the environment of what companies were out there, what their approaches were. We learned that there were a lot of labeling companies that just were local print companies and weren't really looking at labeling in total. Um, In addition, we didn't want to invest in the infrastructure again. We wanted somebody who was really focused on the cloud, and could provide the capabilities, in a SaaS configuration that we could subscribe to, rather than having to invest in all the different infrastructure. Because we run 30 plants worldwide, 50 distribution centers. It's just a lot easier than investing all those servers locally.
Right. I mean, you mentioned cloud, and I mean, cloud is just such an enabler, isn't it? Often when organizations think of cloud, they typically think about cloud from a, purely a cost of infrastructure point of view, but actually cloud enables you to join up the dots, join up the organization, doesn't it? I mean,
Yeah,
we
yeah,
know working with you guys, it's a single platform and you can get, a new factory up and running very, very rapidly and access all those assets and leverage all those
hmm,
assets that you got. So I think it definitely needs to be seen more than just an infrastructure thing. It's a true enabler, isn't it? A true business
yeah.
enabler.
It is. It is. And you're talking about again about how we evaluated. Once again, we went through this we evaluated, looked at the industry, and then we made some acquisitions and we actually evaluated, because at the time Kallik was selected, and then we actually reevaluated once we made some acquisitions, because they also had solutions. But once again, it all came down to who had the best enterprise approach, which is why we ended up where we were.
Yeah, fabulous. Yeah, I know in our journey where you guys went out and tested us again. And
That's
so,
right.
yeah, it's healthy. I mean, it's a healthy thing to do. Yeah. Look, that leads us nicely on to why did you choose, Kallik? What led you to Kallik, and what are the things you saw in us that you felt could really help enable your business?
Yeah, I think the total cost of the platform, because everything we do is some modicum of cost and expense that you have to look at. The capabilities, at the time, we were pretty much producing PDFs for our labels. Kallik introduced the idea of a template design, components of a, and how we can use template reuse as we're dealing with the various designs. The other one is that, Kallik really came at it from a partner standpoint, and really has worked well with partnering with Cardinal, to get, because like I said at the beginning, these journeys are over time, right? And you really want an organization that will partner with you, and adjust as things go forward. And then finally, the SaaS cloud nature of it is why we picked it.
Yeah, look, I mean, the partnership thing is very, very important to us. I mean,
Hmm.
we know, and our whole philosophy, as you've seen, and I talked about today, is about ultimately it's about getting it right for the patient and the clinician. And we serve many organizations whose bread and butter is patients and clinicians and consumers. So relationship is important. For us, it also works both ways because Cardinal, without a doubt, has helped us in our product roadmap, and I think it's healthy that, when organizations like ourselves get into bed with organizations like yourself, it's a two-way street. You guys have contributed massively to our product roadmap, and we have a very open view on having that co-creation approach to it as well. So yeah, partnership is fundamental. It's a long journey, isn't it? We've been
Yeah.
doing this for 8 years together and many, many more years to come. So yeah, very, very important indeed. So
Yeah, and I
thank you.
think,
Thank you.
yeah, I think one of the best examples is we've been, as I said, we had 6 labeling solutions, and we've been converting, and retiring labeling solutions and moving them to Kallik. We went to Kallik and said, hey, we need an automated tool. So if you have an existing tool, I'm not going to say which one it was, but we have several, and we want to take all those labels and convert them to Kallik. What can you do? Well, Kallik really partnered with us and helped us come up with an automated way of converting the labels from one system to another. Now, it wasn't perfect, but it's never going to be perfect, but it definitely cut down on the time. And that's just, to me, the example of partnering that can occur and why it's important to continue to look at the automation opportunities, the AI opportunities. Doesn't take you away from actually validating, but it does help you as far as in the conversion. Anyway, a little bit off the
Absolutely.
subject.
Thank you, Pete. Okay, so let me click the right button there. Pete, would you just talk a bit about how has this really impacted you from a operations point of view and a supply chain point of view?
So, we've been able to increase the amount of reuse that we have in labels. Um, we have improved our overall time frame to design and develop labels. Um, but I think, and I already mentioned this before, but I think the biggest thing that we have is the access to the central repository of labels, and that we can move labels from one plant to another plant kind of seamlessly. You got to go through a revalidation because the printers are different and everything else. That's the med world, but we have access to it, and we're not going through a redesign of the label. And so that's really critical. And of we move a lot of our products between plants to new plants. We have an act. We buy companies. Those things have really, really helped as we move forward.
Great, thank you, Pete, for that. So look, my last question to you, Pete. I hope I'm not grilling you too much, but there's obviously many people on this call today. I'm sure there's people on this call today who are probably seeking advice on, what are the things, what are the gotchas, and what are the things, and what are the advice you would give to them facing similar sort of challenges that you guys had prior to the Kallik sort of partnership. So yeah, look, would you mind sharing some insights on that?
No, I think, as with anything, and a lot of it's driven by the fact that the amount of recalls that are related to labels, nobody really wants to change the labels. Nobody really wants to, hey, if it's working, don't worry about it. That's why we have old systems. But really driving through and building that case for change, which is really important, making sure you have strong partners across the organization to help drive the journey. And it is a journey, and it takes a while, and you have to be patient. But the key is, if you have the shared vision, if you have the objectives that you're trying to achieve, it is well worth undertaking to get to a centralized labeling solution so that you have access to all your labels, that you have compliant and supported hardware across the network. So because we're leveraging the cloud, and that will remain. So those things are all. I think that all comes back to need to be patient as you're working through these changes. You can go as fast as you can, but it does take some time to get through all this. So that's kind of
Great.
those are my big lessons learned.
Fabulous. Thank you, Pete. Thank you very much. Thank you for your candid and open sort of information that you shared, and certainly the experience. So I think for me, always, whenever I was, in webinars or meetings, it's always important to hear from people who
Mm-hmm.
the other side of, the other side of the partnership, the people who have to really wake up in the morning and drink that cup of coffee that we serve you and live with it and know whether it's right or wrong. And so it's always good to hear that. I think that carries a lot of weight. Certainly with your seniority and your experience, hopefully giving some insights to the people on the call today on what it means
Yeah.
in real terms. So, I definitely appreciate that. Thank you, Pete.